So if you've been on this app recently, you'll know that there's been an explosion of cases of colorectal cancer, and different outlets are now picking this up and broadcasting this message. This is an extraordinarily important message, and no, this is not just a scare tactic. In fact, the data out there is pretty startling. Hi, I'm Jen. I'm a GI nurse practitioner. And at this point, the way things are heading, if you're born in the 1990s, you have a 2 times the risk of colon cancer and a 4 times the risk of rectal cancer than those born in the 1950s. In fact, in 2030, it is suggested that colon cancer could be the leading cause of cancer deaths in patients under the age of 50. More so, it's reported that there's 49 new cases a day of early onset colorectal cancer. So why is this important for you? While the screening guidelines still state age 45 is the recommendations, the takeaway message to this video is this. It's imperative to know when you are at risk for colorectal cancer and when to seek out help. If you have a family history, you have 2 to 3 times the risk of an average person. So knowing your family history of colon cancer is imperative. And if that relative is young, for example, your parent, sibling, or offspring, or if there's more than one relative, your risk shoots up to 3 to 6 times the general population. So if you have a family history of colon cancer, it's always best to get checked 10 years prior to the onset of your relative's diagnosis. And if you are of average risk, it's imperative to pay attention to the following symptoms. These are what we call red flag symptoms. If your blood labs show anemia, which is a drop in your hemoglobin, if you have a sudden change in your stools or suddenly get bloated for unknown causes, if you see blood in the stool, or if you have an unintentional or unexpected weight loss. This is the time to talk to your doctor. And please do not ignore these symptoms. Even if a doctor may say that you are too young to have a colon cancer, it is imperative that you continue the discussion if you continue to have issues with these symptoms. And as always, I hope you trust your gut.